Skeletal Muscle Diseases Lecture. The objectives of this lecture are to name and describe the major disorders of the skeletal muscles. Strains are the overstretching and tearing of muscle fibers. The etiology is from lifting too much weight or repetitive motions. The symptoms of strains are myalgia, pain, tenderness, and swelling, and we usually diagnose this by history and physical examination. Treatments for strains are rest, heat, and ice, use of analgesics, and anti-inflammatory medications. Sprains are a partial or complete tear of a ligament. The etiology of sprains is usually trauma or sports injury. The symptoms include swelling, pain, heat, and bruising. And the diagnosis, we usually diagnose them by physical exam and possible x-ray to rule out fractures. Some of the treatments we can use for sprains are the acronym RICE, R standing for rest, I standing for ice, C standing for compression, and E standing for elevation. Dislocations and subluxations. Dislocation is a complete separation of bone from the normal position, and subluxation is a partial separation from its normal position. The etiology can be trauma and joint abnormalities or diseases. Symptoms: acute pain, swelling, and joint deformity, and the diagnosis is usually a physical exam and x-ray. The treatment for dislocations and subluxations are repositioning of the joint in acute cases, and in recurring cases, it may require surgery to tighten the ligaments. Herniated disc. The etiology for herniated disc is a ruptured disc, slip disc, or bulging disc in the spine due to injury, and as you can see here, on top here we have a normal disc, and here you can see the bulge, which then compresses the nerves that come into the spinal column. Symptoms are pressure on the spinal nerve causing pain, numbness, organ dysfunction depending on which nerve is compressed within the spinal column, and possible sciatica if there is a pinched nerve in the lumbar spine. Usually the L4, L5 herniations are what cause the sciatica pain. Herniations can occur at any point in the spinal column. It can happen in the cervical, thoracic, and lumbar spine. Diagnosis of a herniated disc is physical exam, MRI, and sometimes a myelogram. And the treatment: physical therapy, analgesics, anti-inflammatories, cortisone injections, and surgery in severe cases. Bursitis is the inflammation of the bursa. The etiology of bursitis is repetitive motion. Symptoms include severe pain that limits motion in the joint. We usually diagnose this by history and examination and sometimes x-ray. The treatment is rest, moist heat, use of analgesics or anti-inflammatory medications, and sometimes we will do an injection of corticosteroids, or we will drain the bursa area. Tennis elbow is a type of bursitis. The etiology is repetitive motion. Symptoms are burning pain outside the elbow, pain pressing, lifting or gripping objects. We diagnose this, it's confirmed by increased pain when the middle finger is pushed backwards or extended against release. Treatment: application of a wide strap just below the elbow to change the support muscle movement in the forearm, reducing the pain. Inflammation of our tendonitis, which is the inflammation of a tendon or connective tissue that attaches muscle to bone. The etiology is repetitive motion, injury, and can be caused by calcium deposits. Symptoms include pain and tenderness in the area. Diagnosis is physical exam. Treatment is rest, ice, analgesics, and anti-inflammatory medications, and sometimes physical therapy. Carpal tunnel is a repetitive motion injury affecting the hand. And the etiology is the blood vessels, tendons, and nerves feed into the hand and pass through a tunnel in the wrist area formed by the carpal tunnel ligament. Repetitive motion causes inflammation of the tendon, resulting in pressure of the medial nerve. So repetitive motions of this transverse carpal ligament increase inflammation of this tendon pressing on the nerve just below. And what sometimes will happen as far as treatment, we will try rest, splinting, anti-inflammatory medications, and physical therapy first. And if those don't work, then we will do a release of the medial nerve surgically, as you can see in this picture here. The symptoms of carpal tunnel are numbness, tingling, pain, swelling, coolness or discoloration of the hand and fingers. And diagnosis is a positive Phelan maneuver. Plantar fasciitis is the inflammation of the plantar fascia. So the etiology is repeated pressure of the fascia. A lot of times people who walk or runners will sometimes get this plantar fasciitis. Symptoms are pain in the heel or the arch of the foot. This can be very, very painful for people, so don't underestimate their pain when they complain of it. Diagnosis is history and examination. Really, there are no imaging unless we feel like there might be a bone spur. Then we can do some imaging such as x-ray or a CT scan to see if there are heel spurs or a calcanealspur. Usually heel spurs occur after plantar fasciitis has been present for a while. They can form. Treatment for plantar fasciitis is rest, ice, analgesics, and anti-inflammatory medications. Sometimes a walking boot will be helpful, orthotics, and surgery to remove if there is a heel spur. Torn rotator cuff. The rotator cuff comprises of a group of muscles that hold the head of the humerus in the shoulder socket. When we tear this, usually it's right at the top of the humerus. However, there are 3 other muscles and tendons that could potentially be torn. 1 in the back and then 2 in the front. Typically it's the one on the top of the shoulder that gets torn, and we call that a torn rotator cuff. Etiology is trauma generally, such as sports, car accident. Symptoms: tears in the tendons produce a snapping sound followed by acute pain and inability to abduct the arm. Diagnosis is a CT scan. Sometimes they'll do an MRI and arthroscopy. Treatment is surgical repair, analgesics, and anti-inflammatory medications, and then there is a lengthy time for rehab after the surgery in order to get that muscle group working again. Knee tears. There are several types of knee tears that can happen. Torn meniscus, ACL, and MCL. A lot of times these happen with our athletes. So MCL is on the inner side of the knee that can sometimes be torn. ACL is inside the knee, just below the patella. And then the meniscus is right, you have the lateral meniscus and the medial meniscus. Shin splints, overuse injury to the periosteum and extensor muscles of the lower leg. The etiology is increase in activity. Symptoms: pain, tenderness along the anterior tibia worsening with exercise but disappears with rest. Diagnosis, examination, x-ray to rule out stress fractures, and then the treatment for shin splints is rest, analgesics, anti-inflammatory medications, and altering ice and heat. Tetanus, also called lockjaw, is an acute, infectious, and painful disease causing uncontrolled contractions of the skeletal muscle. The etiology is a toxin called Clostridium tetani. The toxin travels in the blood and attaches to muscle or motor neurons, producing a stimuli to contract the muscle. Symptoms include tetany, high fever, tachycardia, dysphagia, and intense pain. Treatment, cleansing the wounds, immunizations. The Tdap immunization is very important to get every 8 to 10 years. Once you are over the 5-year-old mark. Respiratory, nutritional, and hydration support may be needed, and antibiotics and muscle relaxants are used in these cases. Generally, if you have tetanus or a case of lockjaw, you are hospitalized. This is a pretty serious illness, hence why we really push vaccinations on a routine basis.